Question number 3, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he still stand by his policy to deliver better, sooner and more convenient health care?
The Honourable Tony Ryall.
Mr Speaker, despite the fact that the previous government left the health services delivering $160 million of services that were unfunded, yes.
The Honourable Ruth Dyson.
Will the Minister reject the proposal for the establishment of the National Health Board, or is he prepared to now admit that this is a broken election promise with increased rather than decreased bureaucracy in health?
The Honourable Tony Ryall.
Mr Speaker, this is a report by an independent group of people from across the health sector. It has yet to be considered by Cabinet, but look, what I can rule out is anything that will increase bureaucracy or not improve patient services.
The Honourable Ruth Dyson.
Will the Minister instruct Waikato District Health Board to unfreeze their cap on doctors? Or will he concede that the promise to deliver more doctors to the front line is now another broken election promise?
The Honourable Tony Ryall.
Mr Speaker, when I first looked into this matter 2 weeks ago when it was raised with me, I found that this so-called cap on employment is actually referring to the level of staff in the DHB's budget. The DHB this year is forecasting more clinical staff than last year, more doctors, more nurses and more allied health. They are, however, endeavouring to ensure recruitment focuses on those areas of understaffing such as mental health. I've been assured that the DHB has no suggestion of making clinical staff redundant, and they're able to do this because we've increased their funding by $54 million.
Very good. Joe Goodhue.
Thank you, Mr Speaker. My question to the Minister of Health. What responses has he seen in relation to the public release of the Ministerial Review Group report?
The Honourable Tony Ryall.
Mr Speaker, I've received a number of feedback to the independent report. The New Zealand Herald said that the Minister of Health must move fast on health reform and that these are not radical suggestions. The Royal College of GPs said it's about providing the right care in the right place at the right time by the right person, and this report acknowledges the importance of this approach, and the Public Health Association welcomed the renewed focus on quality as a way to reduce health inequalities.
The Honourable Ruth Dyson.
Will he now apologise to the people of Dunstan in central Otago for his broken election promise to them, given the reduction in physiotherapy and disability home support, both frontline health services provided in their area?
The Honourable Tony Ryall.
Mr Speaker, what I would say to the people of Dunstan is that what I would say to the people of Dunstan is that they should have a look at a report that I'm holding here, because I'm surprised that a former Associate Health Minister was silent on this issue when her government approved cuts to aged care services in Wanganui, for example. In 2006, her government agreed that Whanganui DHB had to take fairly swift action, resulting in individuals with lower levels of need being reassessed, services removed and access criteria tightened, and not a word from that member.
The Honourable Ruth Dyson.
Will he now apologise to the older people of Canterbury for his broken promise to them, given the reduction in both home support services and access to rest home care?
The Honourable Tony Ryall.
Mr Speaker, I visited Christchurch Hospital last week and had an opportunity to speak to over 300 doctors, nurses and students. I'm advised that Canterbury District Health Board has not reduced funding for aged residential care, and they are not expecting to reduce the number of residential care beds. The DHB is also refocusing its services on providing home support for people with higher level of need. Their health for older people spending will increase $5 million this year, I suspect if you behave like the opposition health spokesman and read one table saying it's a cut when actually it's an increase, you could get confused by that information.
Joe Goodhue.
Thank you, Mr Speaker. My question to the Minister, what reports has he seen about DHBs and their decisions about how they allocate their funds in relation to services?
The Honourable Tony Ryall.
Oh, Mr Speaker, I've seen a range of reports about the need for DHBs to live within their means, statements from Dr Cullen and the previous Health Minister. But as I've said before, the most interesting is the Associate Minister of Health in July 2004, who was defending claims of negligence from Wellington City Mission over funding cuts for aged care. The then Associate Minister said how health boards allocate funding was not her responsibility. That Associate Health Minister was Ruth Dyson.